Thank you, Governor, and good morning, everyone. As the Governor said, we are moving into a new phase in the Commonwealth's vaccine distribution after hitting our initial goal of vaccinating our over 4 million people by the beginning of June. This is a critical benchmark in our pandemic response as we race to drive down cases and hospitalizations and prevent the spread of COVID so we can start to get back to normal. But we know there is still a lot of work to do to reach even more people, especially in our most disproportionately impacted communities. Today, we are here to discuss how we will begin to shift our vaccine program to more targeted vaccine opportunities and gradually ramp down some of our high-throughput sites. This includes providing more appointments at our 22 regional collaboratives, pharmacies, mobile units, and walk-up clinics. With 4.1 million people on track to be fully vaccinated by June, the demand for appointments at all locations, including at MassVac sites, has stabilized. The pre-registration system, which was launched to provide more ease in appointment booking, will remain available. But appointments can also be conveniently booked through the VaxFinder website as well. That means you can go online right now and book a time that works for you at a location that also works for you. There's no waiting. We now have the ability to offer walk-up clinics and more mobile vaccine units that we hope will offer even more convenient access to these shots. Since the pre-registration system was launched, over 1.8 million people registered and have been offered an appointment at least twice. In the coming weeks, the state is anticipating that the CDC may authorize vaccines for children ages 12 through 15, and we will keep pre-registration available for parents who may want to bring kids to a MassVac site. More details to come when the CDC releases more information. As the Governor mentioned, 4 MassVac sites will plan to gradually ramp down their high-throughput sites by the end of June. These sites include Gillette Stadium, the DoubleTree in Danvers, the Hines, and the Natick Mall. But they will transition their efforts to focus on more targeted ways of vaccinating people at the community level. This includes offering walk-up appointments, and information about walk-up appointments will be available on vaxfinder.mass.gov or through calling 211. As we continue to pivot our vaccination program, mass vaccination sites are extending their vaccines into the community in partnership with local municipalities at trusted community locations. These efforts are already underway in Springfield and in Haverhill, with more anticipated in the coming weeks. Additionally, the 5 FEMA-supported mobile vaccination sites in partnership with the Hines, they have been very successful. CIC Health and Cataldo Ambulance have delivered 12,000 plus vaccinations across Boston, Chelsea, Revere, Fall River, and New Bedford. Mobile vaccination locations have ranged from senior centers to elementary schools to community centers to YMCAs to churches, gyms, local community-based organizations, and everything in between. These efforts have been successful at reaching minorities in our vaccine equity communities. 61% of individuals at FEMA mobile sites have been Black, Indigenous, and people of color. We are grateful for the support from our community partners and local organizations, including our outreach workers at ASG and Healthcare for All, for concentrating on these populations. As we continue, the providers and support networks for our MassVac sites will keep focusing on more creative ways to reach people where they are. The Commonwealth has come a long way in our vaccine program, hitting our goal to vaccinate over 4 million people soon to stop the spread of COVID and to start the return to the new normal of our daily lives. None of this would be possible without the incredible work of our command center, our healthcare providers, community partners, and our municipal leaders who have worked day in and day out to set up vaccine clinics and help spread the word and the work about vaccines. If you've not signed up for a vaccine, please talk to your healthcare provider or visit vaxfinder.mass.gov, vaxfinder.mass.gov to find a convenient appointment near you. Please call 211 or visit the website if you haven't been vaccinated. There are open spots right now near you. If you need more information about just how safe and effective these vaccines are or how they protect you and your family, call 211 or visit vaxfinder.mass.gov. Thank you all for your incredible efforts getting us to this point. We have more work to do, so let's get it done. With that, I'd now like to turn it over to Secretary Sutter.
Governor, Lieutenant Governor, good morning. Dr. Bidinger, thank you so much for being with us today. As the Governor indicated, one of the core principles of our vaccine distribution has been to reduce severe illness and death by vaccinating our most vulnerable populations early on. We have been focused on the effective, efficient, and equitable distribution of vaccines from the start. Among the early prioritized groups were the thousands of individuals who were elderly with comorbid health conditions, residents of long-term care facilities, and residents and staff of congregate care settings who have each experienced greater impact from COVID-19's infections. Not the general population, but our most vulnerable. Our nursing facilities, as we all know, were hit hard early on in the pandemic, and it was critical to protect them with vaccines as soon as possible. Early on, vaccines were brought on-site to our 400-plus nursing facilities and rest homes, in addition to assisted living residences and continuing care retirement communities. 98% of our residents in nursing homes received first doses, and 100% of our rest home residents received first dose vaccinations through the Federal Pharmacy Partnership Program. That translates into more than 34,000 individuals. Today, 84% of our long-term care residents and 71% of the staff are fully vaccinated. And we continue to prioritize and reach out to provide vaccines to nursing homes and rest homes to support newly admitted residents and for staff. And you see it in our numbers. Over the past 7 days, for example, there were 6 resident nursing home cases, positive cases, and 27 staff cases. The combination of vaccines and ongoing surveillance testing is paying off in keeping our staff and residents safe. We will remain vigilant, of course. Our low-income and affordable public and private senior housing has been a successful model of public and private partnerships and the progress that can be made with these strong collaborations. To date, we have administered over 111,000 doses and fully vaccinated over 58,000 adults who live in low-income and affordable public and private senior housing. To offer a little bit more granularity and perspective, this translates to over 850 senior housing complexes across 230 municipalities, including 213 complexes located in our equity communities. This was an all-hands-on-deck effort that included over 170 providers, ranging from local boards of health, fire departments, pharmacies, healthcare providers, our National Guard, community health centers, emergency medical services, and the like. This incredible progress would not have been possible without the partnership of our state's housing agencies, Mass Housing, the Department of Housing and Community Development, and CDAC. And in congregate care, every one of our 400 providers, plus our state-operated programs operating more than 3,500 congregate care sites, that translates to 94,000 individuals, created vaccination administration programs that resulted in the administration of more than 165,000 doses. These range from 8-bed group homes to large facilities, from special education residential programs to homeless shelters to large congregate care facilities and everything in between. Overall, across these settings, 60% of staff have received at least one dose, and 70 to 80% of residents, depending on the congregate care type, have received also at least one dose. Additionally, many of the homeless service providers provided vaccines to individuals experiencing homelessness who won't come inside into a shelter and stay on the streets. With an average 5% weekly turnover at individual shelter sites, reaching all shelter residents is an ongoing effort, and we continue to coordinate with local and regional health providers to ensure that our ongoing vaccination access for shelter residents is needed. As we continue our vaccination distribution, I am hopeful. We've experienced some very dark days over the course of the past year, but amid all of the uncertainty, I have found that in Massachusetts, we never lost focus. We rolled up our sleeves and got to work. I'm extraordinarily grateful for the can-do spirit, the one-size-doesn't-fit-all approach that we have in our state. No one is forgotten, and strategies must and will continue to evolve based on the data, the experience, and the opportunities available. We would not be where we are today without the partnership of all of our providers, from councils on aging to healthcare providers to residential providers to mass vaccination providers, and to the millions of Massachusetts residents who have made the decision to protect themselves, to protect their loved ones and their community. We're in this together, and together we can do this. Thank you. It's now my privilege to turn the podium over to Dr. Paul Bittinger, who serves on the Governor's Medical Advisory Board and who chaired our Vaccine Advisory Committee. Dr. Bittinger, and also has a day job.
So thank you, Governor, Lieutenant Governor, Secretary Sutters. It's a pleasure to be here, as always. I wanted to say a few words to those who may still be taking a wait-and-see approach about vaccination, or who are still considering whether vaccination is right for them and still have questions. As we know, there are 3 vaccines, of course, in the United States that have received emergency use authorization from the FDA that followed research trials that involved tens of thousands of participants in each vaccine's trial. Since the emergency use authorizations were issued, nearly 150 million people in the United States have received at least 1 dose of a COVID-19 vaccine, which represents more than half the population over 16 years of age who are currently eligible. We are so fortunate that here in Massachusetts, approximately 70% of eligible individuals have received at least 1 dose, which is just such an extraordinary number. If people have received a first dose of Pfizer or Moderna and are due for their second dose, please get that second dose, because it's your most effective and longest lasting protection against COVID. But if you've been waiting it out so far, I would like to say, as others before me have said so well, now is the time to schedule your appointment. We now have data from 150 million people who are getting vaccinated, which continues to prove the safety and efficacy of these vaccines. We have now multiple studies in the scientific literature that demonstrate in the real world that the safety and effectiveness of these vaccines is what we saw in the clinical research trials. And these vaccines are more than 90% effective in the real world settings altogether at preventing infection with COVID. And of course, preventing infection with COVID is important, but really, and I say this as a physician, preventing hospitalizations, preventing deaths is really the most important to reduce risks of critical illness. And just in the past couple of weeks, we have seen data that have showed that people over the age of 65 are 94% less likely to be hospitalized if they get vaccinated, if they are fully vaccinated. And in all age groups, we see data that shows that fully vaccinated individuals have a decreased risk of dying by more than 29 times what it would be if they were unvaccinated. In terms of safety, we continue to see data that was in those research trials, and the risk of a serious side effect after a COVID vaccine is approximately 0.005%, or 50 in a million. And by contrast, the rate of death from COVID-19 is 32 times higher than that risk of a serious adverse event, and the risk of hospitalization is 120 times higher. So what we're seeing in the real world is proof of the safety and effectiveness of these vaccines, as we have been saying, and as the data shows. I would like to add one last thing for folks who may be a little younger and may be hesitant because they are less concerned about the possibility of critical illness or death from COVID. And that's that we are increasingly understanding the importance of what we call long-haul COVID, or extended symptoms after COVID infection. It appears, according to the NIH, that approximately 10% of individuals who get infected with COVID may have ongoing symptoms of respiratory, of cardiac, of neurologic illness that persist after their acute infection with COVID is over. And therefore, the best way to avoid these extended symptoms, no matter what age range you're in, is to get vaccinated against COVID. So if you've been waiting to see whether there was more data and more experience, we now have it, and there's really good news about what we know about these vaccines. It's so important for all of us to be vaccinated to keep us safe, to keep us out of the hospital, and the more of us that are vaccinated, the more protected as a Commonwealth we are, the less pressure there is for new variants of the virus to evolve, and the less likely we are to see changes in the rate of infection. So I would add my voice to those who've spoken already to encourage you to book a vaccine appointment if you have not already. I want to thank the Governor, Lieutenant Governor, Secretary. Thank you all.